Welcome, everyone. My name is DJ Wells. I'm the Executive Director of the Mensah Research Institute, and you're joining us for our weekly conversation about coping with COVID. Today, we are going to be talking about international psychology and cultural perspectives as it relates to the COVID-19 pandemic. We've been sharing several key and important topics with you over the weeks, and we will continue to do so in the weeks to come. But today we're very pleased to have Professor Patricia Perez, a professor in international psychology, and Ms. Maryam Tafreshi, who is an international psychology scholar. They'll be sharing some perspectives. And of course, we've got, as always, Dr. Albert Mensa with us today as well. Just a couple of ground rules that I want to touch base on real quick before we turn the conversation over to Dr. Mensa. Remember that this is a live broadcast, and we anticipate and look forward to your participation. And so if you've got questions of any of our panelists, please do use the Q&A function that's there at the bottom of your screen. And after about half hour, 45 minutes of Dr. Mensa speaking with our two guests, then I'll come back in and begin to share with our panelists some of the questions that you're typing in. So go ahead and type those questions in, and we'll get to them as best we can. We're scheduled to go an hour, but if we get lots of questions, we may even go a little bit over. So please do share your questions with us. And so without further ado, I'm going to turn this over to Dr. Albert Mensa, who will share a little bit about our panelists and start the conversation. Dr. Mensa.
Thank you, Mr. Wells. And I want to thank our two guests today. Dr. Perez, as always, it's wonderful to work with you and hear your pearls of wisdom. And Maryam, as always, working with you is a sheer joy. Folks, I want to share with you, Dr. Perez has been quite the instrumental dynamo globally as a speaker, as a counselor, as providing a new and slightly different paradigm to the patient approach. And we've learned quite a bit from her, and she's available. We've got her information available through our websites and so forth. Many of you may not know, Maryam Tafreshi brought me to the Middle East, in particular to Dubai, for the second annual Middle Eastern Conference. She is a go-getter. This young lady is out there in a very good way. She sees a need and decides it needs to happen, and then she brings everyone together to get it done. And you know, this is something that is very well unprecedented for the majority of folks. It takes a very special person with both insight, capacity, and sheer audacity to get these things done. So Maryam I can't wait to see what she does next. It's going to be fabulous. So to the two of you, I say both welcome. And interestingly enough, of course, Dr. Perez is Maryam's mentor. So we are doubly blessed in that fashion. And so let's go ahead and talk about international psychology. First of all, let's move through this process. What is really international psychology?
So thank you, Dr. Mensa and Mr. Wells, for your very, very kind introduction. I'm going to take a few minutes to briefly go through the 3 bullet points that we're going to cover. And Mr. Wells, if you can kindly please show that one slide. Thank you so much. So the first pointer here is, what is international psychology? So international psychology is about understanding the challenges and crises that exist in our global world, which is not necessarily geographically bound. It is about coming up with interventions that are ethically and socially responsible with the consideration of the uniqueness of the context under study. The goal of international psychology is to maximize the health of individuals and societies both, and minimize harm to them. The next pointer is context. As I said, in international psychology, we try to understand the challenge based on the context of that place. For example, and then come up with interventions. For example, what is the history of that place? What is the politics that plays a role? The economy, the culture, and etc. So these factors play a big role in how a challenge exists in a place, and also the interaction, the dynamic that they bring together can create a totally different way of how the challenge presents itself, or the intervention that needs to be developed for that unique situation. The third one, as Dr. Mensa is going to ask Dr. Perez and I some questions, you're going to see that both of us are going to look at the attitudes, knowledge, and skills of the people or even policymakers when there's a challenge and or a crisis. Based on their attitudes and knowledge and skills, how do people respond or react towards the situation? Or based on all these three, what are the interventions that they see fits their need in order to move on through that challenge? So this was just a brief introduction, and Dr. Mensa, I'm gonna let you start with the conversation.
Thank you, Maryam. Maryam, back a few years ago, when we were at the Middle Eastern Psychological Association conference in Dubai, we talked about context, and I'm going to skip ahead to context beyond the definition for a reason. When we are looking at cultural influences on pathology, when we're here in the United States, we'd say, well, this is the problem, this is the problem, this is the problem, and these things need to be treated, and so forth and so forth. To give one example, we had a patient who said that they were hearing voices, and the parents brought us in to talk about the entire phenomenon, except for something very different. Where they came from in their country, hearing voices was expected up until about the age of 15. You had not become a mature adult unless you had actually heard voices. And I'm not going to mention the cultures or anything, but certainly that perspective and the context of culture is very, very important. When you look at society here in this country, and we have a hodgepodge melting pot, a diversity, if you will, how has this sort of reformulated how you perceive your work and what you intend to do and are currently doing in terms of helping other individuals and to give them guidance in the directions they need to go?
I think, studying in the field of international psychology, and also I have been an expatriate for 13, 14 years, living in many different countries, and also immigrated in the US. So seeing, let's say, experts in different fields, whether it's psychology or other fields, let's talk about psychology. What I would like to see as somebody who's studying in this field is really trying, I think we need our experts in every field, especially psychology, to study about culture and diversity. And again, what you mentioned, that the way people view life, or the way they even can experience pain and suffering, whether it's, for example, if there's something going on, the way I might feel that pain, maybe it would be through the gastrointestinal, maybe for my region, or for another one, it's going to be from the, feeling in their head, or a psychological reaction. So this is, I think, very important for the psychology, especially to become multiculturally competent. So when a patient goes there, let's say when I go there, they don't assume there's something wrong, because they're looking at me from their lens of perspective, rather than looking at who I am and where I'm coming from, and understanding me from my side, and creating an intervention plan that really fits my need in order to heal.
Excellent, thank you. And that is so key, so pivotal, because this is part of the reason why we began this communication, this discussion in the first place, looking to help people globally through the lens of globally competent individuals to truly assess culture versus pathology. These are not the same. For many people, their culture is someone else's pathology. That doesn't happen where we come from, so this is automatically a problem. Versus, we're very well used to this and we don't even worry about it. It's a typical part of growth and development. Dr. Perez, You had a very interesting discussion the last time we talked about your evolution in how you work with individuals in your practice before you took sort of a, I wouldn't say depersonalized, but a little bit more of a distance perspective on some things. And after a while, you began to change. Not everyone saw you last time, so I'd like you to share a little bit of how you kind of converted or shifted your program, how you process situations and your personal level of involvement. Can you just refresh us on that before we kind of delve into this intercultural piece here?
Of course. I just thinking about, yeah, I mean, that was last week, and the topic last week was looking at children with special needs given COVID-19. So that was last Thursday, and now moving on, which there is a lot of similarities. But before I go into my answer, I'd really like to thank you again, Dr. Mensa, and Mr. Wells, and of course, Maryam, who introduced me to Dr. Mensa and Mr. Wells for this opportunity to co-present and be here with everyone again. So this has really been quite a treat. So yeah, I think that, thinking about it more broadly and not just assisting and supporting children with special needs, just like Maryam was talking about, that whole cultural competence or striving towards cultural competence as an international psychology consultant. So that's typically what my hat is now, as opposed to before as a psychotherapist with background in diversity and inclusion and children and families, that there has been an evolution. And I don't think I shared this last time, but the evolution really starts with understanding who you are, and that changes over time. So just like Maryam talked about her background and how she was an expatriate, she and I have had actually many conversations about our own cultural norms and our backgrounds and how they're similar yet different, and how that actually moves into our work. So within the international psychology field, which I think Dr. Stevens is with us, he is the father of international psychology, wrote the Handbook of International Psychology. So we're so thrilled. And we also see some students and colleagues, supporters of international psychology. The way that we look at this is so multifaceted. At least for me, it starts with my process is I start with who I am, and what the terminology in international psychology is intrapersonal competence. So I'm looking at myself first and trying to understand, reflecting on myself and how that actually bridges to my inner engagement with anyone really. And in this case, with patients or clients. So then that's intrapersonal competence. Knowing many of the things that Maryam just brought up, that what I may know and what I have learned from at Loyola University Chicago in counseling psychology with a minor in multicultural psychology, all of that is great. However, we can start from the bottom of what the client is presenting to us. So for example, I also say something like, tell me about yourself. Okay, so that is very loaded and complex, because yourself can be the self, like just me, or it could be the self as part of a group, right? And that could also be seen as somewhat pathological in societies that are quite individualistic, that only focus, like only your needs and liberties and yourself matter and nobody else does. But if you're looking at a patient or a client from tell me about yourself, the yourself can be quite loaded from a collectivistic standpoint. So even just that, and then also thinking every single time you say words, how I always challenge myself to think, well, what could those words mean in a different context, right? In a different context, just like Maryam has said, politically, what does yourself mean, for example? What does economic? So all of these things, it's quite complex, but that just gives you a little bit of a flavor of that process of really focusing on the client. I mean, thinking about that, but then also going back to yourself quite often to make sure towards that cultural competence. We're never going to master and be, I'm a master of cultural competence, because we're lifelong learners. We're always learning as we engage with diverse populations. But that's what makes this fun. I mean, I'm going to speak for myself. That's what makes this personally and professionally a fun field, because no two people and no two communities and no two contexts are the same. So, I can talk on and on and on, but I will stop at this point.
Dr. Mensa, would you like me to give 2 live examples from the psychology and from the medical?
Absolutely.
Okay, so I'm going to bring an example myself. One of the things is, when you migrate or expatriate, every time this happens, it doesn't matter how many times you do it. And this was actually in my used it in my thesis. Research was showing it doesn't get easier; it can get harder, because you're disconnecting, and a part of your identity is actually shaking, and you need to kind of rearrange that part of identity. There's losses because losing friends, disconnection, and grieving process. And so it's a process, but we become stronger also. So for example, it was during a time, there were I'm coming from a culture, there's a lot of hugs and kisses, a lot of connections, seeing family, exchange of love. So when we moved to one of the countries, I don't know for how many times it was already. And at the beginning, our partners traveled so much. And at that time, I also lost my grandmother, let's say. So there was a lot of loss, a lot of loneliness, trying to learn how to figure out things with 2 kids. So the company was offering some counseling. I decided, why not? Let me go talk with somebody. And I just started actually the master's program of international psychology. So, which I'm very glad, because I knew then how to talk. So I was going, and then I said, you know what? I really I miss to go and hug my family. I just miss that. All of a sudden, that person being from a different culture, her culture, they don't even kiss each other. There's a distance, and even parents, they don't do that. So she was saying, all of a sudden she said, no. People like to have their space. So this is actually very dangerous as a woman if you need hugs. So she was taking it, and I'm not going to use the term, towards a very different place, what that means to want to hug. And I was shocked. Then when we wanted to say bye, when I wanted to say goodbye, she made sure to kind of teach me, have her space, and do that. That ended the relationship. She called, and once she called me one time, finally I answered, and I said, you know what? I'm studying international psychology, and I have to tell you, I couldn't see the multicultural competence there. You're looking at me through the lens of your culture. So, this is not really helping me. Another one was, again, having autoimmunity, and I know disconnection. I'm a very that's my strength, connected person in culture and individually. So every time we want to move, sometimes, I get this very pain in my stomach. Few times I had to go to emergency room. So the doctor wants to give me pill or whatever. You know what actually helped me? A friend brought me rice. As soon as that connection started, I healed. I learned every time I want to move, I need to make sure I create that connection with a loved one, whether it's friend or not. So these are 2 very separate things that, I just wanted to mention from psychology side and medical side.
Mm-hmm. Thank you. That was actually very informative and very correct. We because of the dimensionality, the multidimensionality of the culture we live in here in the United States, every person literally carries several different potential cultures within them, whether they're exposed and new to it, or whether it's something that is in the ancestry and buried. There are still components that filter through, and we may not recognize it. But one of the things that we do in terms of medicine, in terms of healing, let's talk about healing, is first we do really have to identify, where's this person coming from? What are their sort of root cultures? What is it that creates normalcy versus pathology for them? And even now, as we sit with social distancing, which makes it very, very challenging because of this COVID situation, it becomes even more intricate, because for some individuals, there may not be much of a challenge because they're used to being very individualistic and alone. And even then, that's still a fallacy, because in the core, we need connections. So that person may be going through depressive tendencies for a very different reason, than the other person who is so used to having a very close-knit family relationship, where they may call, they may text, they may do visual aids through Zoom and so forth, but it's not the same as being physically there with the family once a week or twice a week and getting that hug, getting that embrace, as you talked about, Maryam, which then also sort of pushes the whole dimension of depression, anxiety, and frustration. And what if you've got one of each? So what if your mate is coming from one of those cultures that's kind of separate, and you come from a culture where you are all grabby closey, and now you're locked in this confined space where you want this, and that person says this is kind of normal. So each one of you responds to this particular crisis differently. And you don't quite understand why the other person behaves the way they do, or why they may be more at peace or more at stress with the current situation. So sending them to folks like you and to Dr. Perez. Dr. Perez, how do you sort of respond when you get that particular dynamic? And I'm sure you've had them. The couple
Yes.
seeking the therapy, and they're coming from
Yes.
two very different places on this.
Yeah, well, I think this actually ties into last week's discussion. There's a core theme here. And again, this is a bias. Okay, so I want to preface my answer by saying this is a bias because of my professional training in counseling psychology, in development, child development, and my own personal and professional views of looking at strengths. So all of that, right? And depending on what your industry is, depending on what your background is, whether it's medical, psychology, business, it doesn't matter, but that becomes, just like Maryam was saying, that the lens that we look at, coupled with now international psychology, that I look at strengths. So instead of reinventing the wheel and being, not having humility that I think I know somebody's culture or family dynamics, I may ask, depending on how I observe where the hierarchy is in the family or in the group or with the person, in hopefully that way. And let me also say that we make mistakes, right? We're not perfect, even though we have these contexts like Maryam was talking about. We also make mistakes, and from those mistakes or perceived failures, they're opportunities. So I start off with saying something like, well, what works in your family? Okay, or what works in your group? And they go, well, what does that mean, Dr. Perez? Okay, so given the scenario that you just said, as far as like one person likes to be close together, one person likes to have separateness. I mean, you're actually sort of speaking about my own family of how this is working in a family. I also hear from people and people who want to consult in multi-generational homes because they're all together. Mm-hmm. Yeah. And how to spend all of this time. I mean, part of it is, so if we start with what works, I invite together in this conversation, not like I'm the expert and I know everything, but an invitation to collaborate, to come up with a plan, knowing that the family probably has the skills and the competencies already of figuring some of this stuff out. I'm just happen to be the sounding board or the guide. So that becomes my role, not like I'm the therapist, I know everything from that point of view. So they might say something like, well, okay, well, this person annoys me. This person wants to touch me every time. This person, why don't they understand we're in shelter in place? Why do they have to go outside all the time or whatever? Then what happens in the dialogue is that we ask, well, why do you think, knowing this person or family member, why do you think this person is doing that? In recognition that you might be a togetherness as a family or a group, but knowing that each person has their own coping mechanisms in order to do it. So I'll just use my family as an example. I don't think any family members are here, but they do know I'm presenting, so they can watch the video later. That for me, I'm the type of person that I need this. Like, this is something I need. I need to be talking to someone, checking in with someone constantly, right? My husband is similar in his own way, and he has his own group. And this is the observation that many of us have. Like, we can also tell our client or patient, what do you observe based on thinking, feeling, and behaving, like behavior that makes somebody look like they're not as depressed, not as, in sort of not great behaviors, right? Like, so I come from that standpoint. of having them guide me in what goes on, as opposed to me making the assumption that I would know the answer and having a blanket strategies for healing, blanket strategy for trying to give advice or guidance to everyone without even getting that information. So I start from there. I don't just, and I think we talked about this last week in terms of like the DSM-5 and how they have those culture bound syndromes, and how, I mean, it's better every edition. And actually that's also a developmental and trend setting and what we in our society, which is predominantly Western, considers important. Right? And all of these, and what socially and culturally is important. However, I feel like the way that I gives even more to the context of what's going on, and secondly, what do they consider healing? Like, what's healing to them? Because what we may consider healing is not having a diagnosis of PTSD anymore, not having a diagnosis of OCD, not having a diagnosis of generalized anxiety disorder. However, for them, maybe they want something else.
Very clear. Thank you. Maryam, you brought up something very interesting in your discussion just now, where you referenced the fact that before you were going to transition to another country or another culture, you would get physically ill.
Yes.
The detachment piece, and this is one of the things I want to bring up, because many people come to a physician or to a healer of some type, and they say, I have all these problems. I have an ulcer. I have gastric issues. I have, irritable bowel issues. I've got all these things. I've done all these tests and I've gotten nowhere. And no one has actually taken the time to do two things. Number one, get to know who that person really is underlying, and assess whether or not this is perhaps something that starts somewhere else from within and has manifestations because of the stress, because of the anxiety, that are physical in nature. And that happens so often, and people don't recognize that. And when I say people, I mean practitioners, I mean doctors. We sit down and we say, well, here, take some Pepcid, or you take this, or gosh, take berberine and heal your gut, take, zinc, this and do that. We've got to really take a look at all aspects of this person, where they come from, and their relationships, the entire dynamic. Easier said than done, but it can be done. That's really called listening. You can learn a lot from 10 minutes as a practitioner if you're quiet and you let your clients, patients talk. So, Maryam, you went through the bowel issue, and I can tell you there have been other patients who we spent literally 45 minutes to an hour talking to them, actually listening, and just asking some very key questions as they went along. And then we find out that there's an issue of PTSD in the past, as you mentioned, Dr. Perez. And not too long thereafter, irritable bowel syndrome issues started. And there was never any healing. One person was actually an issue of forgiveness. They held on to anger and rage for so long. They had done everything on the planet, been to tons of different practitioners. But after an hour and a half of conversation, they brought up something interesting, that there was this one person in the family whom they still don't get along with. And I said, oh, let's talk about that. And they said, well, long story short, this is an area that this person could not forgive. And I said to them, do you realize the damage you're doing to yourself? Context. You are having a negative relationship with this person who no longer is even thinking about you as of the last 10, 15 years. Who is getting the damage here? Okay, you are. So a lot of times these physical manifestations that we so-called call illness can arise because of contextual issues, cultural issues, and all sorts of phenomena that are not physiologically initiated. They come from elsewhere. They come from relationships. And even the dynamics that you guys were talking about, you individuals were talking about, with where the family members are in place and what they need during any given situation. What they need, well, I'm easier and I'm okay to have my peace of mind. I need more so the interaction piece. I expect you to be 100% of everything on my checklist. I'm letting you know no human being on this planet could be 100% of everything on your checklist. And we have that clash. And why? Because that's how our parents were on this side of the family tree. But our parents here on this side of the family tree were very, very different. So context is very huge. It's extremely important for many people. And that really is not explored the way it should be. And then even knowledge, as you had on your board there, knowledge. And we talk about information that we don't have about our mates, that we don't have about our children. Children, they're very funny people. They grow, they evolve. And the child we had yesterday is not necessarily the same child we had today. But how often do we really check in with our children on a more personal level to ask them, what's going on? What are you thinking? How are you perceiving this? We talked about this last time, Dr. Perez. What are our children's thoughts and feelings with regard to a certain situation, and how is that changing? We've got it easy because we pretty much think we've got us and our spouses and so forth figured out. But the kids, gosh, yesterday they hated baked chicken. Today they love baked chicken. Tomorrow they can't stand this, and it keeps changing. So it's one thing to have static knowledge and consistent context. But our children, for example, don't follow any of those rules. How do you see that in your practice, Dr. Perez, working with family members as they're trying to cope with their ever-evolving children, especially in times of crisis?
Oh my goodness, Dr. Mensa, you're asking some really hard questions. Goodness. Again, it's very complex. I would say, I mean, from an international psychology lens, counseling psychology lens, and developmental psychology lens, I mean, those are all of basically my background. And also as a parent, I think that there can be several strategies, but also knowing that, I mean, I think the baseline here is that many of these kids didn't have, they're going through in their own way grief and loss of what they didn't realize was going to happen, including the adults. And the family members in the family system, those adults can be models for how children interpret what's going on, and whether or not there are resiliency patterns or resiliency patterns, or how they're actually moving forward. We can also think about the fact that children, whether they have special needs or don't have special needs across the lifespan, developmentally they're also going through this stuff. So it's very interesting, because the way that I address some of this stuff is asking really first how the parents are doing. Like, you know, how are the adults doing? Because typically, you know, I know there's this saying, like, happy parents make happy children. Okay, you know, I mean, that's very general, but as we role model, right, whether or not we're stressed out too, whether it's finances, whether it's you know, basic needs, whether it's something that we have to do in terms of like everyday taking care of children or caregiving for others, whether even it's an elder, while we're taking care of children, and understanding that there's going to be shifting dynamics during shelter in place and how we're thinking about this. And also the uncertainty is being honest. I mean, developmentally of where they're at. So how the families, how the grownups are doing, how they're also engaging with their children, and what they're observing. I know a lot of parents are observing regressive habits, right? Their kids are regressing, like, and, you know, and not necessarily like they're wetting their bed and doing all this stuff, but they need more hugs, right? They need more of the touch, or they need to be close somehow to like live people. And sometimes parents find that annoying. And I go, well, you know, why do you think they're needing that touch a little bit more? And so, you know, we talk about that so that they develop that process of understanding from a developmental. For some, for example, teenagers who already like to be in their rooms or by themselves or don't talk too much. I mean, that's a very stereotypical, you know, picture of that. Maybe they withdraw even more, right? But they don't withdraw on social media. And hopefully, I mean, that's a whole nother level of making sure that they're monitoring the social media. Parents and caregivers can also be watching a lot of stuff that's going on in our world today without then spending time with their children. And so all of those things, and observing, I think observing is really, you know, like why don't you write down, if you want something concrete, observe and write down, and we could talk later about what they're doing and what they're not doing, because there could be similarities and differences. Rituals are really important. I recommend that. Many of them already have rituals, which means that they gather together one time during the day to have discussions about what's going on. They even have roundtables or games or things like that, you know, and talking about those type of things. So, you know, and that's maybe one way of healing and feeling like they're together during a time of such uncertainty and chaos, to keep things, I guess, normalized, which is really a hard word.
It is. It's an interesting lead in because, and Miriam, I'm going to do something a little bit maybe challenging for you. I've had the pleasure of meeting at least one of your offspring, a delightful young man at an institution that I will not name. But as a collegiate coming home with the COVID phenomenon, you've got nearly 3 different generations, 3.5 generations in your home that really have adapted very well. To me, your family epitomizes the need for international psychology. Coming from one culture, moving to several different places, now you've got different generations who are now thinking, they're processing, they're behaving differently, their roles have changed. But at a time of crisis and they come together, you've seen some very interesting things happening in terms of their behavior. Miriam, would you care to share that side of the story?
Oh, definitely. And Dr. Mensa, if you actually want to mention that you went to Purdue and my son helped you, I think it's actually very important, because there's an assumption that students, young people in their, let's say, 20s, especially boys, there's an assumption they don't care about health. We had over 100 students there, mainly boys. And they were extremely interested. They were asking questions, they're supporting each other. So I think this is so important, that there's a thirst for knowledge, for healing, for health, chronic illness, whether it's going to be mental or physical. So you feel free anytime you wanted to discuss that, please, because I think it's very important.
And before you get started, I will say to the brothers of Sigma Chi, yes, from Purdue University, good for you and congratulations.
Thank you.
This core group of young men really took to the forefront here and tried to provide help for their colleagues at that institution who were suffering from depression. Rarely do we have a conference where for 2 hours, the room is predominantly filled with more than 150 people. That's how critical this piece and discussion on depression was from the perception of the college students here. So parents, as an example, don't think that because your kids are off in college, life is hunky-dory and they're doing fine. They are oftentimes silently suffering. And these young men decided they're going to take a good foothold here and do what they could and do their part to try to help provide information to everyone who could possibly attend. And they publicized this, school-wide, and we have a great diversity of people who showed up, males, females, athletes, non-athletes, combinations of therein. So I just wanted to say that once again to thank you so much, Sigma Chi, over at Purdue University. You guys are awesome. And now Miriam, as the founding mother of one of the founding individuals who brought this whole thing together, share with us sort of the role transition and how adjustments have happened really in your family with the COVID phenomenon. You've shared some interesting stories with us before.
I was actually, it was interesting because I was trying to look from outside to see how they're going to do and what they're doing. Kind of what is it from their characteristic they have learned? What is it maybe they have learned from us that we have told them? Or maybe they have learned from us something that we haven't said. All 3 of them, they're, I have a 13-year-old, 18-year-old, 21-year-old, and they amazed us. They really amazed us. They're being informed, we're not hiding anything from them. They're being informed, but we're not turning on the TV the whole time, just enough information, and they're moving forward. Each one of them are being automatic, taking responsibility to go study for what they need to do, their exams. They're becoming creative. They said, you know, this is what we have to do. For example, our oldest son was supposed to go on a spring break trip. Many of the students did, but he decided he's not going to do it because, you know, CDC was mentioning it's best not to do that, but they didn't really ban the trips. So, you know, he decided to come home. This is the best thing to do because if we travel, we're going to be in the airplane with other people and we can actually get the COVID or bring it back home. So I was very proud of, you know, the decision that he made. He came home and then now they're being creative. They love to go work out outside. They're doing body weights. They bring creative. They're engaging. They're actually appreciating the time to be together because they all know pretty soon they're all going to have their own separate lives. So we're being very happy. I think from all the moves we have done and all the resiliency we tried to teach them, whether it was from what I learned from my past, from my parents and family, or my husband has learned, we tried to teach that, or through our experiences of the move, whatever we needed new to learn in order to cope and move forward, not only do that, to grow. So it was surprising to see that they're actually doing that. So it very much, I think it's children look at us as parents. Am I going to say all the time, use the words, oh, I'm sorry, oh, you know, or feel all the time down and disappointment and how I'm going to do that. So let me go have another drink and I'm going to have that jar of ice cream because I can't tolerate this situation. Kids will learn that. Or, you know, are they saying me, you know what, I'm going to take this time and I'm going to challenge this challenge. I'm going to actually have the time go work out and, you know, do my studies, do video calls, and I go and ask them. And I have to say, sometimes as parents, we might think boys don't want to talk or don't want to engage, or when they get older, they become teenagers or older, as Dr. Perez said, they might need some space and we have to respect that. But they really don't want to be alone all the time. So what do? I go check in. If they're staying in their room, I talk, I give a hug and a kiss, and I start a conversation.
I do that too.
For both of you, I'm going to go here. That's very stereotypical. That's a very motherly thing to do according to stereotypes. Mm-hmm. Now I'm going to flip the switch, as they say here. Maryam, I know for a fact, as you told me, your son did something very unexpected and very non-stereotypical, non-prototypical. They came to you to ask, how can they help you in the home?
Yes.
Your oldest and your 18-year-old both came to you at different points in time of their own volition, and they were taking more of a leadership role in helping the home environment do better. They stepped out of themselves, because normally we think about boys as being very selfish, very, you know, closed off. And that's why I jumped in here between the two of you, because we have an absolute example, two examples of how young men in development, men in training, if you will, took on a more sensitive role to ask how they could help move the ship, which is their home, mm-hmm. in a much more fashionable, a much more accurate, wrong word, a much more appropriate direction. That really showed sensitivity. That showed that you raised some good boys, Maryam, because they looked at need and they were going to meet that need at a very different level than what perhaps their own culture might share, what their own culture might provide. They've stepped out of that and they're looking multidimensionally. They're becoming their own people. And they're showing their values that you've indoctrinated and that they've picked up as well in terms of what is right in this situation to do and what makes me feel good. I had to brag on your boys there, Maryam.
Thank you. I think that comes back to the assumption, having assumptions that kids don't want to do anything. It's the same assumption of kids all want to just eat sweets. That's a wrong assumption. They love vegetables, actually, and good food.
Or adults who just want to eat sweets.
Yes. So you know, the assumption that, for example, as a mom, I made that mistake. I thought, because I'm trained to read who wants what is their need. I don't need to even communicate that sometimes. I just go and do it. So, but from their part, it was like, oh, mom seems to have the energy. She's doing it. She's not asking for anything. And so she's okay. To me, it's like, why aren't they, offering to come and help? Nobody cares. And then one time at 4:00, I was exhausted in my room. I couldn't even function anymore. Then my son came, why don't you come and tell us? Then I was like, oh, you're right. I never thought about that. So again, it's different ways of communicating, which goes back to need. I wanted to mention that you talked about needs of different partners. The meaning, this is what we talk in international psychology. What something means to me can be different in meaning for the other person. So it's very important to talk common communication. What does relaxation and peace means to me? What does relaxation and peace means to you? For me, it's, come and talk for a few minutes, have a tea together, let's cuddle up, let's watch a movie. And for my partner, might be more of having that time to himself or go play golf. So communicating that and trying, probably two people came together because they love each other. Find a middle ground that, as Dr. Perez said, we can't prescribe something. They need to come to see how can they feed each other's need. And it was interesting because during my thesis, my thesis was about increasing the long-lasting happy life of expatriate couples. And research after research came up about the needs that the couples have. They have to know it, and they have to know it can change as the years change. Those needs they will change. So they have to come back together and communicate. How has that changed for them? So it's like a business. One of the research was saying it's like a business. The same way you're producing something for your client, both partners, you have to talk about those needs so you can kind of feed those needs as much as you can that is agreeable by both of you.
And businesses change context by context if they survive, right? Dr. Perez?
No, I mean, there's a lot of things that Maryam said I really want to speak to, and we talk about this in international psychology, the high context and low context of how people engage with each other. So for example, in high context, I might not say directly, I need this. Like a partner might say, I need this, and that's how they communicate. High context, it's really looking at those nonverbal cues, looking at everything, but it's almost like saying, whatever I don't say is what I need. While the person on the low context end is you say something and you mean it, okay? And so that is also what gets a lot of this. So like I was brought up in a high context culture from the Philippines where you're supposed to look around your surroundings and sort of know what the next steps are, what you're supposed to do. And I would get in trouble as a child that I wouldn't figure that out, that I need to know that. No one tells me, honey, I need for you to give me a hug right now. You're supposed to sort of know that. So that I think is very interesting in terms of couples, families, and especially now of like people who are exhausted potentially to say, you can't figure me out. You can't just like know this.
Yeah.
And also families spending even more time together than they've ever had before, potentially, because everyone could be busy and doing all of these things. But now, potentially, we have a chance to all be together and maybe quiet and still. And then what do we do with all of that? And so we turn to our family members or we look around and like, okay, so these are the individuals that I get to be together and shelter in place. And what does that trigger for us emotionally, right? Like, what does that trigger that then leads into the behavior? Now, us as moms or parents or whatever, we can't do everything either, right? I mean, we have to be kind to ourselves as well. Also know when to step away to take care, moments, mindfulness. I think we talked about this, but also knowing that high context, low context, that not everybody and not also everybody has the same love maps. Right? Like with my husband and I, he directly says, honey, let's watch a movie. And so when he says, honey, let's watch a movie, we watch a movie because that's time together. Even if we're quiet still next to each other, that's our time together. Or for example, maybe I may have a look on my face and like, oh, mommy's exhausted. Or our 16-year-old will say, Mom, come into my room. Let's hang out together. And so I have the excuse of being able to eat, teenage food and be able to know what's going on in his world. So it's really, it's really now a chance for us to get to know our loved ones. So when we get out of this, which I don't know what that really means, that we have more skills, right? For really everyday life.
What were those terms again? High and low, what?
Yeah, high context and low context. Yes.
Here's a thought I have for all the couples out there, especially the women, okay?
Okay.
Look, I'm sorry, as a humble man, I know for a fact, X number of us function in the low context phenomena. We cannot read minds, circumstances, or anything else. Well, don't you see this is not here? I'm sorry, I was working on 30 different things. I didn't see that wasn't there, so I didn't get it done. Tell us, okay? Tell us, please. Now, here's the other thought. We are in a new context with this shelter-in-place thing. And couples, I know it's going to sound very under-methylated of me, but create a schedule of opportunity that you share with your significant other. Agree to when you can take 5 minutes here to provide 5 minutes for your spouse, your loved one, to do something else if you've got kids. Provide that time, or perhaps schedule the time so that everybody can anticipate a moment where they can breathe while you've got 2 or 3 little ones running around all over the place. While you're at the computer trying to work, they're literally jumping on the chair and doing your hair because they think you're at home, they're at home, it's playtime. So this is a great opportunity, a great time to really sit down and plan. Plan as much as you can to ease the stress. And yes, you can't plan your entire day. I'm sorry, some under-methylators can and do. I'm not going to tell you how I know that. But you can literally provide enough hope and therefore stress release for your family. And when your kids say, gosh, can you come and play with me? Or your teenager says, I want you to sit down, you're in the middle of a project. Don't just tell them, listen, let's do this later. You say, you know what, Jonathan, okay, right now I'm in the middle of this, but I tell you what, at 7:15, we're going to sit down together and we're going to do that particular thing. You validated your child, you've told them you do care, and you have given them a plan. And that's really what they want. They want absolute verification that they matter in your lives. And you will see a different result from your kids coming out of that, okay? I want to thank, Maryam, do you have another comment?
Yes, I wanted actually, because some people are going to be new and they might be from the psychology side. Can you please explain, because they might not have heard you talk, what does under-methylation, over-methylation mean? Because it's related to psychology. So they kind of can understand what you said here.
Well, the way I'm going to put it is I'm going to give you some examples. So methylation is really about molecules that are attaching to each other, kind of like Legos. And once they do, they regulate your system like a light switch. You turn on the light switch, the lights come on, electricity flows. You turn off the light switch, things don't happen. You need a certain number of these molecules present in your system to have balance. And this balance can affect neurotransmitter production, neurotransmitter activation, which is key. So in psychology and psychiatry, we often talk about serotonin, dopamine, norepinephrine, different neurotransmitters. But if those neurotransmitters are not activated, it doesn't matter how much you've got there, they don't do anything. And you can still become depressed, even though your test levels may say you've got enough. Most tests don't show neurotransmitter activity. They show neurotransmitter presence. So individuals who are undermethylated tend to have not enough regulation, activation of neurotransmitters, enzymes, hormones. Even your DNA doesn't function as well as it should. Overmethylators, on the other hand, are the opposite extreme. They have hyperactivation of all of these symptoms, of all of these enzymes, hormones, and neurotransmitters. So they have a very different thinking process. They're highly creative because their brains don't shut down. The undermethylated individual tends to be very regimented, very professional, usually very high achieving academically. They're on the on side of the push to succeed. They're the doctors, lawyers, engineers, psychologists, psychiatrists, engineers, I said those, educators, teachers. A lot of individuals move in a certain direction because they have these particular traits. And believe it or not, a lot of that has to do with methylation status. So when we talk about undermethylated people, that's in a way a bit of a euphemism for your planning, very thorough, very regimented, highly organized, moving on to professional life or not. And that can be a lot of mommies out there, because I don't know how a mother can have multiple children and not be undermethylated, okay, in terms of being successful at managing all those things. Now, don't get me wrong, it doesn't mean overmethylated moms are bad, but this is really the 2-second version of what methylation means in undermethylated. Okay.
And the reason, thank you so much, Dr. Mensa. The reason there was a purpose for this that I asked you, because in international psychology, it is very important for us. We're kind of a bridge to bring different disciplines together. For example, in order to understand a challenge or a crisis, or let's say even this challenge of depression that is becoming high, anxiety that is becoming high, which is one of the issues that United Nations Sustainable Goal number 3 is part of that. You know, it's asking, please come with your ideas, share with us. So it is very important. We believe in international psychology, in order to solve global issues, different experts from different disciplines need to come. They need to hold conversations in order to say how they're seeing the issue. And then conversations come up. They can disagree, they want clarification, which we should not get intimidated by that. That's a fantastic thing, because it kind of allows us to fill up those gaps of what we don't know or we thought we know. Each one of us might at the, when, especially experts, I have a way still to get my PhD, but for the experts, they have this fantastic lens of knowledge that is very deep, but it can, if they only stay there and they just rely on that lens and kind of say, I'm not going to listen to other disciplines, other lenses, what's going to happen is we're looking at an elephant and we're just looking at the ear, or we're just looking at the leg. So coming together is important, which, if it's okay, I want to ask actually a question from you and Dr. Perez, because this is very dear to international psychology and being an advocate for global mental and physical health. I want to ask both of you, like right now we're waiting, because this is related to COVID. CDC is telling us, and they're saying, we're waiting for the vaccine and it's going to take a year and something. Let's do social distancing. We're going to listen to all of this, okay? There was on the TV this fantastic conversation between governors last night, and I loved it. They would tell their ideas. Some of them had economy background and child development background, like Dr. Perez. And for example, and they were kind of going, like Dr. Fauci said this, and I say this, and this is the risk. For example, Dr. Fauci was saying, we're going to wait, we have to wait for the vaccine to come. If not, economy, if we come out, economy is going to get hit harder in development. The other one was saying, no, if we stay inside the house, economy is bad. Okay, so let's say we're waiting for the vaccine, we're staying at home. As a practitioner and as a developmental psychologist, let's say from a parent, what else can I do? Let's say if I'm staying at home, what can I do that I can still nourish that development in my child? And from a practitioner medical side, what can I do to strengthen the immune system of my family? So in case I get it, I know there's no treatment yet, maybe I get it mildly, I bypass it, something like that. I know you have approaches and we're using it actually, but I think there's a thirst for this knowledge for people to know. And hopefully maybe policymakers are listening. What is the advice you want to say? What is the gap that you see as a practitioner that maybe you want to give your expertise, or as a developmental psychologist that you would suggest to policymakers to share? What is it? What is your wish? I would like to hear that as a student in international psychology. And sorry for the challenge. I hope you
Oh, no.
excuse me.
Dr. Perez, you said I asked.
What'd you say, Dr. Mensa? What'd you say, Dr. Mensa?
Tough questions. That question's all yours to start.
Okay, well, that's a great question, Maryam, and I'm glad that you're open to listening to the governors and all these diverse thoughts. So I'm going to be responding as a parent and also as somebody who, you know, a lot of my master's degree and a lot of my consultation is in child development, that within a lifespan perspective, our life goes on, right? Our life goes on. However, it's a different life than we expected, okay? However, things like biology, things still happen, okay? Still, there are changes. However, things like, for example, from a physical point of view, there are changes because there are people who have food, who don't have food, have nutrition, who don't have nutrition. So there is change over time. However, during this time now, there is different types of changes that may not have been expected from a parent point of view, that in their course of life, there has been a stop. So as far as encouraging and motivating children in that development, we're actually working, you know, and the encouragement is we're actually working with what we have, okay? What are the laws and policies within, and whether we choose as citizens to actually follow them? I mean, that's a whole nother conversation. So that's number one. What does it mean to be safe and healthy and protecting our families? And then within our homes, our children can actually continue to develop, right? So given, you know, an example is, you know, if the food that you have, things like that, being able to exercise in place, potentially, I mean, all the things that were our lives before now have to be accommodated. This is where the creative side of the parent needs to happen, that those things can happen. For those college students, you know, I have a college student who is not with us, but is away. I talk to her every day so we can have those conversations with us. That is emotional, social, right? Cognitive. I'm holding her, hugging her, and saying, you know, someday we'll be with each other soon. Our kids have aspirations of what they want to be, right? I hear from parents where the kids' aspirations have now turned, like they don't want to go to college anymore. They don't want to pursue the things that they want to pursue before. So then that's where I said, well, what are their skills and talents? What can they do? Again, the same thing. What do they like to do? And then walking them through, okay, if COVID continues, if we're in shelter in place for another year, all of these things, you can still pursue these things. It may not be how you envision that path, but as parents, this is a perfect opportunity to highlight, like how I got to international psychology. I think you know this, and many of the students on the call, and actually my friends and Eric, everyone, Dr. Stevens knows this, that I didn't start in international psychology. There were a lot of different paths that got me here, right? And so you're an encourager. You're saying, yes, we can continue with life. You still have skills and talents. That hasn't been taken away, right? What the parents can provide with the resources, being kind to yourself. Those are things move. Things are still moving in our life as we are scared and wondering all of these things. It's a day-to-day or hour-to-hour process.
One of the things that I learned from Dr. Perez last time, which really I never forgot, very interesting, talking to children and parents, not from the perspective of what is it that your child can't do, but from the perspective of what is it that your child can do. And paying as much attention, if not more, to the can do part than the can't do part. And that you just kind of touched upon just now, Dr. Perez, which is fabulous. So we're in this situation. How do we view this contextually, right? If this continues here, if we don't get back to this level of interaction, socially, externally, et cetera, how do we move forward? And that's an important conversation that I really think needs to be had. From a medical practitioner side of the equation, forgive me, I've not actually had a chance to view that conversation from yesterday. I will, between the governors and so forth. But we are molecular scientists in terms of what we do. And it's very interesting because we've got a very different view of what's happening here with this COVID than the approach that most of most of society is really taking towards this. We're not looking at a vaccine. We're not looking at drugs in terms of therapy. It's most fascinating. Nature, the creator of the universe, whoever you believe in, etc. We as individuals on this planet have been provided mechanisms for survival. We will survive. But the key is, what you're asking, Miriam, is how do we better arm ourselves to enhance that survival to a thriving state and a thriving capacity? Now, I'm actually not going to say much today because a week from today, my partner, Dr. Judith Bowman, and I are going to talk a whole lot about the mechanisms of COVID, about biochemistry, how these pathological issues come together and make things either more difficult or not, and how we truly support being healthy, thriving, prevention of illness, and perhaps even in the worst case scenario, surviving the illness if you get it, okay? I'm not saying, by the way, that if a vaccine comes out, don't get it. That would be almost very challenging, not smart thing to do, okay? If there are certainly medications that truly do work over time, then by all means, they are a consideration. Globally right now, they've got an interesting research study they're doing between 2 pharmaceutical medications and 2 nutrients, by the way, okay? So we look at this side of the equation, the nutrient side of the equation, and why? I'm going to give you a preview. Look, we're like a car in a way. I've said this before. You're not going to take your fanciest car, let's say a Rolls Royce, take it to a dealership, and they're going to tell you, well, you know what? Your hoses are missing, your engine isn't working properly, your spark plugs aren't there, da-da-da. And they're going to turn around and tell you, well, we're going to put duct tape around the whole engine and hope it works out for you. Say, no, take me to the dealership guy who's going to replace the parts. We were given wonderful parts that work well, but when they don't work well, you've got to put those things in place to support those parts or replace the parts. And those systems are natural. They're natural. We've gotten too, well, I'm not going to get preachy here. We often rely too much on things like these other creatures and the drugs and so forth. They're not the actual mechanisms that are being challenged. And so they're not the mechanisms that need to be in place in order to promote thriving and survival and protection, okay? And protection. So that's where we're going to go next week. We are going to basically answer your question and probably a whole lot more than you ever asked. We're going to talk about how copper disorders or dysregulations affect the mechanisms by which COVID work in a negative fashion. We're going to talk about pyrrole disorder and COVID. We're going to talk about zinc. More importantly, we're going to talk about the key mechanisms of COVID that now lead you to understand how to correct the underlying causes that COVID is working through. It is an outside agent. It is affecting a system. But you know what? I'm going to give you a preview. So we understand, in quotes, right, Miriam? We understand, because that's the context, that's what we've been told. This is a respiratory virus that has all these crazy, mysterious manifestations. Wrong. This is a vascular virus. This is a virus that affects the blood cell system, and it has its manifestations in a respiratory capacity as well as a blood clotting capacity, and with things like, everyone talks about the cytokine storm. Those are chemicals that once inflammation begins, it has this huge domino effect of releasing all these chemicals. Many of those chemicals are called cytokines. Those chemicals now influence systems to become dysregulated. But we have to understand the actual underlying mechanisms are, guess what? They are biochemical. And if they're biochemical, that means there are natural elements to combat and treat this thing and even protect a lot of us, okay? Most people who are nutritionally sound or who are on nutrient treatment protocols, they don't remember the last time they got sick. What we're doing with them is we're actually fortifying their treatment protocols, making them a little bit more intense for the next 3 months. But you ask them, they honestly don't remember the last time they got sick. I had one interesting story from a young person, a mom I talked to. I said, well, how are you guys doing? When was the last time your youngest child who's got autism was sick. And you said, you know, it's really funny. 4 of us in the house got the flu. The only one who didn't get the flu in the house was that kid who was on the nutrient program. So we're talking about immune health and immune support. We will be delving deeper into that. But there are truly mechanisms of treatment. We're not talking about necessarily, you know, prevention through artificial means, but giving the system what it needs to do to fight. Let's think logically. We've been on this planet for how long, and how many generations of us, and how many human mutations have allowed us to survive and thrive, right? We can't be quite so fragile that by artificial means alone we can survive. There are natural things we can do, and we're going to get to that. Actual mechanisms, not conjecture, not theory, but actual mechanisms that are here to help you with understanding and then give you direction and guidance to move forward. Okay.
Thank you, Dr. Mensa. And I hope, you know, this is my hope. And, you know, from 2017, we have been working on this, that while we're looking at a crisis and intervention, policymakers are coming with interventions and informing people, because people look for information of how the media gives it, policymaker gives it. They include more experts of diverse disciplines, such as yourself, you know, Dr. Perez coming that has a mix of international perspective and development. We need this. If we ask, you know, the first thing we learned, I remember we learned in international psychology, is the question you ask for conducting a research. If you ask the wrong question, you're conducting the wrong research. Or if you ask the same question, you're conducting the same research similar to everybody else that is playing it safe, or maybe at least it's not innovative. So as global, Duke Global Health was mentioning, there's 1 million scientific research coming out. On an average, if 10 people on average read one, policymakers sometimes not necessarily read diverse ones, so they're asking researchers and experts to come and talk more on the media, informing us. You know, we have this thirst to know more through you guys. And I hope this is going to start to happen and policymakers start to include different ways, not just one or two.
Okay, I'm experiencing technical difficulties, so I don't know.
Yeah, we're seeing a couple of instances where the feed is cutting out a little bit. So,
Mr. Wells,
yes.
I want to move to questions, because we've had some. Thank you, Maryam and Dr. Perez. You've brought forth, as usual, some great insights into what we need to really consider with reference to international psychology and where we sit now with COVID. Mr. Wells, do we have any questions that our guests can answer for today?
We do, and the couple of questions that have come in, and we're already a little bit past our scheduled time, but again, if you've got any more questions, folks, get them to us quickly and we'll try to get them answered. But the couple of questions that we have seen come through have asked specifically about the COVID-19 mitigation strategies that are out there. The idea that we've got these strategies that are based in science, but then, as all three of you were discussing earlier today, people's cultural worldview might lead them in a different direction in terms of how they interact with each other and how they interact with the world around them. Is there a way to promote safe, science-based health practices without violating cherished beliefs, without violating cultural norms?
Dr. Perez.
I think I know who asked that question, but I think he's gone. But I'm going to ask it. Thank you so much, Dr. Stevens, for that question. This is really hard, because I think this is what's happening, at least in the United States and globally, as far as making decisions. Are we believe in our core values and culturally the science, or something else, right? And so it's really that's what's really hard. So it then becomes our own. And when I hear people give very different views, whether they are students, my own colleagues, or people that I work with, I mean, that's a whole big question about what is actually safe. I mean, so for some people, they are social distancing or physically distancing, and they're following the orders of wherever they live. And other people's aren't even with the science, okay? Even the scientists who believe it and are the scientists then may not, for whatever reason it is, go out and do things that they're supposedly not supposed to do. So as far as coming up, it becomes a conversation, right? I mean, and I think that's what people are trying to do, continue having these conversations. And Dr. Mensa, you explained something, you know, because I'm not a medical person. I know a little bit, but that's not my area of expertise. But there's that piece of it, trying to come up with a similarity to a shared goal. So what is similar among all of our disciplines and science and your core values and all of this? I think our shared goal is for us all to live and for us all to be safe and healthy. However, how we go about that really depends on the context of where you live, who you live with, how you're stressed out about being at home or not being at home. All of those factors then, right, then becomes the context of culture, of really talking about what that looks like.
Can I give a international psychology perspective on this also? I had a very interesting talk with Dr. Stevens, and we were kind of navigating the different ways people can think. For example, sometimes we have to see, based on their beliefs, what people think the cause of the illness is. Some people might think, you know, it's a punishment from God. It's an evil eye. It's something that we didn't do right. It's the cosmic force that is doing this. And then based on that, then they might think they need to go through it to purify themselves, their spirits, or they're going to look at their, their leaders, whether it's a religious leader or their ideological leader or spiritual leader, to try to come up what is the right thing for me to do. So then the matter of trust comes here. That's another thing in international psychology we talk. You know, some people lose the trust based on the power distance that is there. And some people actually thrive for that power distance and want that. They want somebody to tell them what to do, what not to do. So in international psychology, sometimes we say in order to bring change, we need to maybe come and get the help of the people in the mid-level, the mesosection of the culture, the authorities, the religious leaders, the spiritual leaders, the ones who are actually ready to hold conversations about those beliefs, those ideas, the scientific beliefs, and together have their influence because they are respected within a big group, and people will follow them and then move forward. For example, I have seen in different religions around different countries in the world, some religious groups and authorities believe in science also. They believe in God, but they believe in science. And that's how they're leading the people who actually have respect for them. So people are trying to, do what the science is saying. Other religious leaders, for example, do not believe in that. So as a result, since they have the respect within their communities, people are going to follow them. So it again comes to we study about social marketing and change. We need to see the leaders who are ready for change, who are ready to hold a conversation, and we move forward together by respecting each other and just creating an intervention that works for all.
Thank you. Maryam, I'm going to put this very lovingly. You made this 1,000 times more complicated. I had a very simple patented answer that I was going to give, but you gave something that I'm going to have to actually meditate on. The issues around perception and motive, and again, context. If you are a leader who believes this is a spiritual phenomenon and you must go through it, then perhaps social distancing is not what you're going to recommend to your followers. And so this becomes a different issue. I start with a very basic assertion, which is the science. And what Dr. Perez referenced is survivability. If you're not looking at survivability, if you're not looking at thriving, if you're looking at perhaps self-flogging, if you're looking at that as a measure of your devotion to whomever or whatever, then you're not going to obey many of these recommendations. So the lens of the person who's viewing the instructions from the government, the instructions from the governors, the mayors, that all comes into play in their decision-making to cooperate or to not cooperate. However, coming at this purely from a medical perspective here, it doesn't matter what your beliefs are as far as any kind of disease or virus is concerned. If there is that exposure, certain things will happen. How you get there or protect yourself, that is the lens by which individuals and their culture and their context comes into play. And that's what many people are fighting to do. Many of our governors are not trying to stop us from having our liberties. They are trying to protect us. But then we may not view that as protection. We'd rather have our lives back, even though it could make us either sick or cause someone else to die. But that's our perspective. But we should label it really as our perspective, and many people have. But they need to understand that many officials at the state level and otherwise are really seeking to do nothing than preserve life and then move towards economic issues at a latter period of time. And it gets very convoluted and very complicated from there. But once again, we simply say, once you get exposed, it doesn't matter what your beliefs are. The system is going to move through you the way it is designed to. Virus's job is to survive and replicate. And whatever it does within a given system, because of certain conditions, is going to happen. Our goal is to try to add another layer of protection for you, so that somewhere between government restrictions, your perspective, and illness, there is support and buffer to try to minimize that illness capacity. Okay, Mr. Wells, we have another question.
We've got a couple more questions. I'm going to combine the two questions that just came in because they're both kind of in the same ballpark here. But the folks are asking about other mitigation efforts that have been tried in other countries. Some of them successfully, some of them not so. And I know that we, in past conversations, have talked a little bit about collectivist cultures versus individualist cultures, and that was raised earlier today as well. The fact that some countries have been very successful in their mitigation strategies. And then one of the other people who have sent in a question is asking about other types of mitigation strategies altogether, like thermal imaging in airports, those types of things. So the question, I guess the combined question is, are there ways to encourage Western policymakers to either look at other people's successful or unsuccessful mitigation strategies, and also the cultural implications that have made those strategies be successful?
I'm going to address the first part of that. Okay. You can't make anyone look at anything in a particular way. These folks are not silly. It is by choice and by design that they move through a particular direction based upon what their goals are for their countries. We see this here in the United States. We see this in Brazil. We see this in Italy, in France, in Scandinavia. There are many countries, and you look at what their particular goals are, and they bring policy to follow that. Okay. And that's the same thing that's true here. Okay. So there are plenty of different strategies for mitigation. there are plenty of different strategies for economic support for the people in the given country. But it is back to the leadership for them to decide in their wisdom or perceived otherwise, okay, to do what it is they feel they need to do. And as citizens, we end up being the recipients of whatever that perspective it happens to be. It's not that there's a lack of perspective here. We've got tons of countries that each have different strategies, and some are extremely successful. Some were successful, and a few errors have been made, and things have started moving the other direction. And then there's some that are not so successful. So this is from our perspective right now, is a matter of what leadership chooses as their primary goals. Okay, and that's a very complicated issue. So that's all I'm going to say about that. Okay,
Yeah.
Dr. Perez and Maryam.
Yeah, well, I mean, just like you said, I totally agree. I think it's a leadership issue, whatever leadership means, okay? I mean, this is in collectivistic versus individualistic societies, knowing that that's a spectrum. So not all collectivistic cultures and countries are the same, and not all individualistic countries are the same either. So there's all of that. The other thing that I would add is, if the leaders, if that's really where it's going to start, if they're going to listen, if they want to listen, if they even want to listen, right? If they even want to listen to any other thoughts. Now, from a researcher psychology standpoint, what we usually do, and Maryam, you know this, some of our students know this, you do a scholarly review of what has been done, or even like a program evaluation of what has been done, to then come up with the best educated guess based on what has been done, theory, concept, all of this in a discipline potentially. So if you're not willing to do any of those processes, and you're just focused on just just whatever we think is right based on whoever that leader is, then there's no way of knowing or even thinking about what could have done. And if you don't continue to evaluate your program or your strategies to decrease cases and all of that. I mean, for example, like my sister lives in Vietnam, and they were on lockdown for 22 days because right from day one, their government started contact tracing. They did all of these things. Everyone stayed at home. And so, but we don't know all of the other factors within that context of how all this happened, because I'm not there. I mean, I get a report, but that's it. And how many people, what's the population? Where do people live? Like all of those things then is on the burden of the leaders. So I guess if they don't listen, they don't look to their neighbors and allies and say, oh, well, what have you done? And they're not talking to each other in given context, then they can't pool any resources and say, you know what, I'm going to do a little bit of this, or I'm going to do a little bit of this, I'm going to do a little bit of this, or this makes sense to this context and country.
I'm going to use the term that we use in international psychology called Enlightened Globalization, which Dr. Stevens mentions to it a lot. There's a globalization which, like, forcing through the media, the globalization, not the enlightened one, through the media, we force it by the internet that our value is the best of how to do. So we're the best and you're inferior and you have to follow us, and people start to do that. But there's something called enlightened globalization. And what that means, if as individuals or as cultures or as policymakers, we don't be threatened by each other, the different cultures or different ways that nations do things. We try to, yes, value our values or our culture, how we do things, but there are parts of our culture or parts of things that don't work in our nation. And if we start to look at each other, what is it that is working there? What is it that is working in that country or that culture? Can I, and ask the question, would that work exactly the same in my country and culture? Or can I bring that in, kind of mold it, that it's gonna fit my culture? Kind of thinking. Sometimes we rush, we see something is not working in my nation or in my culture. I look at another nation, especially if I'm very exposed to the media to that nation. All of a sudden, we always say, and in Iran, we use this term, from a little hole, we fall into a deep well. It just gets worse. No, we have to think about the process. Change, it's not about doing blindly, that, okay, mine doesn't work, so that's doing it differently, I'm just going to jump and do that. But we can look and then kind of think, can I use it? Can I mold it? And this is called enlightened globalization. This is how our cultures can thrive. The way we live is going to thrive. And I hope one day we get into that.
Me too. Mr. Wells, any other
Agree.
questions?
No, that's all we have in terms of questions. I knew that this would happen. We had three very outstanding speakers with three great perspectives, and we've gone a half hour over, so we should probably wrap things up here.
Miriam and Dr. Perez, I want to thank you both for your discussions, your perspectives, shedding some wonderful light on things in terms of how we perceive process and really how we need to evolve in how we approach everything, whether it's this situation with the COVID or even just really dealing with our children. It's been great, and Dr. Perez, we look forward to more conversations with you. Miriam, we're certainly going to have more wonderful endeavors with you. And we are very grateful for both of you sharing your time, your family's history, your personal stories. Both have been very, very intriguing and enlightening, and just really just mind-blowing in terms of what you've been through and just the idea of willingness and the need to change and to continue to evolve. And both of you really exemplify that. I want to thank you both again so much for coming and talking and sharing with us.
Thank you so much.
Thank you.
Let me mirror those thanks as well, and also thanks to all of our attendees, the folks that have listened in here with us live, and who have asked some questions, and thanks to all of you who are going to watch this when we have it available for video replay down the road. And so for those of you who are watching live, in about later on this evening, certainly by tomorrow, we will upload this video, a replay of this video of this conference to the Mensah Medical YouTube channel. We'll also post links to the video to the Mensah Medical Facebook page. I encourage you to go back and revisit some of these outstanding pearls of wisdom that have been shared today, and also to encourage friends and colleagues to take a look when they have opportunity to do so. You can find all of the coping with COVID webinars that Mensah Medical has produced over the last several weeks also on that YouTube channel, so please do take a look. There's lots of good information there that can be useful to you and to your friends and family. As Dr. Mensa mentioned before, next week, Dr. Mensa and his partner at Mensah Medical, Dr. Judy Bowman, will be with us to talk about biochemical imbalances, biochemistry in general, and how that relates to COVID-19. So we encourage you to come back and join us again next week at the same time at 4 o'clock a week from today, and we'll have that conversation. And again, please share the information with friends and family. This is information that's important that can help all of us. Thanks again to our panelists, to all of you for tuning in, and we'll see you next week.
Thank you, Dr.
Bye.
All right.
Thank you, Miriam.
Bye-bye.
Bye-bye. Thank you.
Bye-bye.